Welcome back. August is National Breastfeeding Month with a theme of Nourish, Sustain, Thrive. Today I am joined by certified lactation consultants Beth Seidel and Rhonda Woodkey. Hi ladies, how are you doing today?
Great.
Good.
How are you?
Yes, I'm wonderful. I'm good. Yes. So can you share a little bit about why you went into this field to support families?
Sure. I've been a lactation consultant in this community for 27 years, and my journey really began with breastfeeding my own children and having some challenges with my first one. And I really learned about the value of support, and that's why I ended up choosing this career.
Yeah, it's wonderful.
Yeah, and I've been a lactation consultant for 21 years. I've been an OB for 6 of those, and I also had my own difficulties starting off, and I really didn't want parents to feel unsafe and unsupported going home from the hospital.
Yes, okay. So can you tell me, so here in Peoria at Carle Health Methodist Hospital, how do you support human milk feeding families?
First of all, we are a baby-friendly hospital, and that means that we have a lot of practices in place that help to support parents to have an optimal birth practice for family bonding and to meet their goals with infant feeding. We train all of our staff additionally in how to best support infant feeding. Our physicians who have privileges are also trained. The lactation consultants see the parents every day, the ones who are choosing to feed their babies human milk, and we also have outpatient services as well where they can come back for continued help.
Okay, awesome, awesome. So what are some common questions that you get?
Well, that is a really big question because we have things, from how do I know when my baby's hungry? How do I know my baby's positioned well? How do I know when my baby is getting enough to eat? How do I maintain my milk supply when I return to work? And honestly, everything in between that.
Okay, yeah. So how do you help parents understand when to know if the baby is getting enough milk?
So we teach all parents how to recognize that their babies are getting enough no matter how they're feeding their babies. So when it comes to human milk feeding, we teach them to look for signs of active feeding. The baby's eyes should be open for part of the feeding. You should hear swallows. We talk to the parents about how the breast, if they're feeding their baby directly at the breast, how the breast should feel before a feeding and after a feeding. We talk to them about checking for baby's output. How many pees and poops is baby having every day? What is appropriate for each age? And also just to get their information from the baby. Babies will typically let you know if they're hungry, and we encourage parents to listen to their baby.
Okay, awesome. So how can human milk be stored and for how long?
Well, depending on which resource you're looking at, you're going to get a variety of different answers for that. But we usually talk about the rule of 4. So 4 hours at room temperature, 4 days in the refrigerator, at least 4 months in the freezer. It can be longer depending on that as well. But then after it's thawed out, then they would need to use it within 1 hour.
Okay. And does breastfeeding provide health benefits for baby and mother?
It does. I think that the evidence is very strong on that at this point, and most people know that breastfeeding is very good for babies. It reduces the risks of many illnesses. It improves digestive health. I think a lot of people don't know that babies are not just healthier when they're being breastfed, but those benefits can last across the whole lifespan. People are less familiar with the advantages for the parent who is providing human milk for her baby. Women who breastfeed have a reduced risk of most all female cancers. They have improved heart health too, even later in life.
Okay, yes. And now for the mothers that are undersupplying or maybe not breastfeeding, how would this benefit them?
Are you asking about how, if they still get those, those benefits? There are definitely benefits to the parent who is providing breast milk for their baby. We do know that some of those benefits, the longer you provide milk, the more those benefits are. So they do come with choosing to, or breastfeeding.
Okay, awesome. Well, thank you so much for joining us. More information will be available on our website, 25newsnow.com. We'll be right back.